All right, my mic is fine now. Good morning, everybody. Welcome to this week's streaming. So today it's a little bit more of a casual, little talk and chat, and a little bit live update, perhaps. But I do want to give a little update on the COVID vaccine. So it's not very of a high priority now for everybody. But nevertheless, there is this updated COVID vaccine now. It's available. Now it's available. Now, just to be complete as usual, I always bring up what the official says, right? So that I don't get flagged of anything. CDC recommends everyone age 6 months, 6 months, not 6 years old, 6 months and older get it. Plain, very simple language, and regardless of previous infections and vaccination history, right? So it's very simple language. That's what they said. Now, you could argue either way, right? Simple language can be good for people who don't want to overthink, right? At the same time, it doesn't offer a lot of guidance, right? Minimum guidance. At this point, I think a lot of people don't need a whole lot of explanations to either welcome or not welcome a yearly COVID-19 vaccine. You've already made up your mind, I'm sure. Here, want to just provide a little bit additional information to support or support your idea, no matter what your idea is. Okay. Here, just to answer, okay, by doing so, I'm going to answer a few questions I think many people would probably like to ask or have it in their mind about this updated COVID-19 vaccine. And at the end, I would give you a little bit, idea of how I feel, how am I compelled to get it or not, okay, based on my uh, analysis for my personal situation as well. Right. So the first questions that a lot of you probably would have in mind is, well, should I get a vaccine if I had just had a COVID infections? This is quite common, and especially when we're hearing a lot of summer wave lately. Yes, we hear a lot of it on some of the news medias. At the same time, I think there is some regional variance. If in terms of is there really a wave or not, but that's another debate. Now, one of the most studied area in this is in comparing, hey, infections and then vaccinations is already a year old. Not a whole lot of update in terms of these studies, but I'm just gonna pull these studies, just give you a reference here. All right. So this study basically supports that this was published in 2023 May, and very quickly take a glance is that, well, if you had a infections less than 3 months ago and you try to get another vaccines, basically this says there's no immunological benefit or significant antibody boost, right? So there's like, well, 3 months is pretty much the guidance. So you had a COVID infections, no help to get another vaccines, no help to get another boost, because your recovery from your infections, give you uh, very high yield of antibodies or for the time period. And then another older study, even older. This one, I don't know why it was still in preprint, but it was in like 2022, probably published already. But basically, it tells you, hey, if you wait 8 months, okay, your antibody level is going to be like 11 times higher than waiting for 3 months, right? So these are references. I would just say these are references. Definitely not a medical advising that, hey, you should wait 3 months or you should wait 8 months or something like that. But give you a ballpark, okay? Give you a ballpark. If you just had a COVID infections in the summer, how are you gonna, you know, uh, work it out in the next few months? Well, then the next question, okay, question number two is that should I get a vaccine if I haven't had COVID for a long time, or you never had it, or you doesn't bother you? Now that is a very tricky question. So I think it all depends on overall health of a person. Like if the person and also the person's individual immunological responses to COVID-19. Whatever we pull from study, there's always this whole group of cohort or data. But individually, and I know people get vaccines, they get very sick the day after. I know people get vaccines and like it's like nothing, right? So this wide spectrum. Now, but however, it is well established that no matter what versions of the COVID spike protein they put into the mRNA vaccines, right? What the maximum antibody protections from that it's about 4 to 6 months, and that is universally agreed at this point. They haven't changed the science since day one of the vaccine rollout. They only changed the spike versions, to match a little bit closer to the circulating ones. And then, so this maximum protections 4 to 6 months, it drops sharply regardless of previous immunological responses. And so what it means is that these days it is a little bit getting even harder to get a effectiveness number, right? Initially we have clinical trials and then we have a little bit ongoing monitoring. Now it's pretty much all retrospective. And the another part of it is, well, almost all of us have some form of immune response to this virus already. So it's either from vaccine, from infections, from whatever, from unknown exposure, you name it at this point. So it is not a direct effectiveness from that vaccine anymore. Now you can only say that, give a ballpark. Maybe if you get it, for the durations of the few months, you get protections from symptomatic infections about 40 to 60%, which is about the same of these yearly flu vaccines. In fact, now it could be a little bit more, could be a little bit less. It has a spectrum these days. The expectation is that, well, if you really try to not get sick, in the winter seasons, okay, for then maybe probably at the end of the October or something around that time could give you the maximum length of protections in terms of antibodies level, all right. So that is probably the judgment call for everybody, if that's what you would like. Now, should kids get them? All right, should kids? I know there's not a lot of parents here at this point. Maybe we watch people will look at it. Kids, how about kids? Now I'm a parent, so I want to think for myself, think for my child. The US CDC again, it's make it very blanket, simple statement saying that everybody 6 months older get it. 6 months older get it. The UK, okay, the UK do a little bit different things. They recommend kids that are high risk with chronic conditions to get it only. Right? If you're healthy kids, you don't have to get it. Well, don't have to. What it means, it translates into probably not as essential. Now, of course, UK have a different, healthcare system. It's the NHS, it's the nationalized, payout, versus in the US, it's private insurance for kids, and it's different. Right? It's different, and the approach is different. Culturally similar, but the thinking and the approach to healthcare definitely healthcare culture is different. I would say that. Now, again, most parents at this point, I'm sure, have experienced something about COVID. Maybe kids went to school, bring back COVID, or something like that, or maybe they just have a COVID vaccines, or in either at some point in time, maybe due to mandatory, school mandate or other reasons. I'm a parent myself. I have my child. It was started the he's 12 now. It started he was like what 4 years ago. It was eight. So went from a spectrum from very young to now moving into into puberty now. He's healthy. He doesn't have any chronic conditions, and so I'm not very compelled at this point, for my child. And now that is my opinion. Every parent think differently. First of all, I need to clarify that I'm not an anti-vax or anything. My children do receive vaccinations. Like my child like does receive that. Now, when it comes to children's vaccinations, I think there's several questions that I ask myself. Like, is this essential? What I mean is measles, mumps, rubella, diphtheria, pertussis, tetanus. Well, these things are essentials. And there's a proven technology, proven effectiveness, proven needs to get them, right? So definitely these are needed for children. And the bottom line is the COVID-19 vaccine at this point, like I said, they haven't changed much other than the protein versions of it. And with that in mind, the idea, right, for a long time, this is now this vaccine is to prevent serious illness, right? Prevent serious illness. That is the main goal, right? Even though sometimes they want to say, hey, the the effectiveness preventing symptomatic infection, but that is not the goal for this vaccine at this point. And they, like I said, they haven't changed anything. So so that is something that I have in my mind, and for CDC to give out this simple recommendations, probably is going to help parents that who don't want to think too much. So just have the CDC decide from themselves. I'm just not those parents, and that's who I am, and I've done too much schooling to not think it through. I just think that that's my opinion here. Anyway, now so this year there's a little bit difference. The Novavax vaccines, like the protein, right? The protein one. So the question number 4, mRNA versus protein. The protein vaccine has been uh, in the buzz for as long as I remember, like even mid 2021, something around that. But almost nobody has been able to get it, like unless you're enrolled in clinical trials or something. But this year, I think the availability it's a little bit higher. Just a couple days ago, FDA did a emergency use authorization for Novavax updated versions of the COVID-19 vaccine. Now, no matter how they update, and no matter it's mRNA vaccines or the protein vaccines, they updated to a versions of spike protein that are already not in circulations, basically. So there was a couple months ago they were in major circulate, but now it's gone. But they try to closely match as much as possible, just to keep in mind. Now, Novavax protein, okay, I'm not trying to sell anything here, okay? I have no affiliation with Novavax, just plain talk, just plain talk. Are they any better than mRNA vaccine? So, one of the latest study in this area, let me pull the article here, bigger. Like one of the latest article in comparing mRNA vaccines and Novavax is already a year old. Like again, everything here it's a year old now. Um, so in summary, is that well, the protein-based vaccines would produce fewer antibodies, and in the short time, because of the fewer antibodies, you may have more new infections. But in the long run, we're not talking about years. Long run's probably beyond 2-3 months is the long run. Protein-based vaccine appears to last a little bit longer, meaning that the drop in antibody levels seems to slower than mRNA vaccines. Now, most importantly, the protein-based vaccines is more established by all means. And even though they have a little bit newer, adjuvants added to this Novavax, the side effects are generally less. Right, generally less. Multiple studies have shown that Novavax protein-based vaccine has less side effects, particularly some of those bothersome next day fever with the mRNA vaccines. Like I said at the beginning, some people, I know many people, no matter how many they get, the next day they're gonna get fever. And Novavax perhaps is a better option if you're still considering. Right now, so it comes to the questions, you know, and that I raised in the title. Am I compelled? How compelled I am here? So let's just think it through. Let's regroup here. Basically, this year, I think if a person's want to get it, they probably can get it. All right, there's nothing too much. If you have experienced the vaccines in a more pleasant way, maybe that's okay. That's okay. If you have very uncomfortable side effects, or really just bad things happens, then maybe you should rethink a little bit deeper. Now, for someone that is young and healthy, like me, right? I'm just give you a flat answer. I'm not so compelled. I'm not so compelled. Why is that? Well, just a little bit live, sharing a little bit live experience in the past 2-3 months. So I've been traveling a lot since June, international travel. I flew a lot. I went to Hong Kong, went to Japan in June, went from Osaka, Kyoto, Mount Fuji to Tokyo. So a lot of traveling, even inside of Japan. Now, over this 3 weeks course in June, did I hear anyone got sick with COVID? Yes, yes. In my circle, one friend in Hong Kong got COVID, and a few days later, but we met for dinner, and the person looked completely fine, recovered, and I haven't heard anyone in my circle got COVID lately in the so-called summer wave. Now that's just my experience. Maybe you know someone that has been infected in late in the last few months. Let me know. If you know how they recovered. Is the symptoms more severe, less severe than in the past? Any lasting effect? I would like to hear more about that. I so far haven't been able to spot a lot of these lately. And again, 2 weeks ago, I flew again to Denver for a science conference. And last week, if you watch my video, I recorded in my hotel room with Star Trek background there. Anyhow, there were over 100, not 100, over 10,000 people. Right, at the conference, a little bit more than 10,000. There were expos, there's vendors and exhibitors, very crowded, and tons of dining events, very crowded. Almost no one was wearing mask at the event, all right? And there were no announcements of anything related to COVID-19 during the conference. So I want to say is that definitely this virus is living among us, but at the same time, it is definitely not the same as before. So the official recommendations remain the same as years ago. Blanket recommendation, 6 months and older to get it. So I think at this point is like we have to think of it for ourselves. Think of your own personal health status, particularly, and to make some of those individual decisions. And thankfully, I think right now most of the mandates are gone. If not all the mandates are gone, I don't see any particular strong evidence to even support a mandate at this time, even like particularly in college kids and all these. So that is my assessment. But nevertheless, CDC is the same recommendation. So I need to reiterate that. Now that's my assessment, my opinion there. Not giving you a medical advice, but here providing references and some resources for you to think it through. All right. So that is everything I want to catch up with you. But so let me see if any of the comments here. Yeah, I'm so sorry for having a stroke after getting a booster. That is possible. That is very possible. I'm sorry to hear that. Yes, the children situation is very tricky here. You know, always there's officials recommendations, but if you really look at the statistics there, at certain age group, this COVID vaccines, even hospitalization rates are a little bit more similar to the flu one. So it's really depending on the individual baseline health status at this point. All right. So just to wrap up this time, then maybe next time I want to give a little bit more throw talk here. Perhaps there's one more questions in your mind, like it's like how long do these things last? Now this paper has been sitting on my desktop for over a year. Basically, it talks about the durations and how long these mRNA vaccines last in your body. In a nutshell, one sentence: 30 days. 30 days. 30 days, and particularly sometimes you can find it more so in the heart muscles. So it is something that is worth a little bit talk. Now I let it sit for on my desktop for over a year because that last time when I do the stream, there was that recall of recall. Is that called recall? No, called uh, retractions of that paper that I talked about in my last stream. So I want to be a little bit more careful. Okay, a little bit more careful this time. Let the paper sit a little bit longer. See if there's any extra recall retractions. And this one doesn't happen to have any retractions. So perhaps next time I'll give a little bit more detailed talk. Break it down about how are they going to, how do they assess and how why are they lasting so long in the body compared to traditional vaccines. But anyhow, that is everything for today, and I want to um, say have a nice day, a nice evening, but nice to see everyone that is always here. Jim, okay, and Jonah, and all those that are consistent show up people. uh, yes, I'm a little concerned too, and particularly some of the uh, situation where filtration is adequate, especially in outdoor, and when filtration is adequate, indoor space, there's no solid, you know, convincing evidence saying that in those situations, mass has any beneficials to it compared to more crowded and less circulated space. All right, so that is all for this week. Again, thank you very much for tuning in. If you are on the East Coast, have a nice rest of the evening, not evening, the rest of the day. And if you are in the US again, have a nice long weekend, Labor Day weekend, and I'll catch you up next time. All right, thank you, thank you, thank you, thank you, Jonah. Bye bye.